Post-operative care following implants or bone graft. General instructions. On the day of surgery, do not rinse, spit, or drink through a straw. Do not disturb the surgery site or overexert yourself. The day after surgery, continue normal brushing and use a saltwater rinse. 1/4 teaspoon salt in a glass of warm water every 2 to 3 hours for 3 days. Pain may last for 10 to 14 days following surgery. Usually, the 3rd day is the most uncomfortable. Following surgery, you should eat a soft diet for 24 to 48 hours. Avoid chewing over the surgical sites until instructed otherwise by your doctor. You should supplement your diet with plenty of fluids and gradually return to your normal diet as tolerated. Avoid spicy foods and drinks for 2 weeks. Avoid alcohol or smoking during the 1st week following surgery. Ice packs may be used for the first 24 hours after surgery to reduce swelling. You may have sutures placed in your mouth to control bleeding and hasten healing. They will dissolve on their own within 1 to 2 weeks. There is a doctor on call 24 hours a day. If you were given gauze, change it as directed every 30 minutes until active bleeding has subsided, usually 2 to 3 hours. Some bleeding may last for 24 hours. Specific instructions. Apply ice to jaw for the first 24 hours. Leave immediate denture, partial, or flipper in mouth for 24 hours. Then remove it and begin saltwater rinses. 1/4 teaspoon salt in a glass of warm water. Rinse every 2 to 3 hours for 3 days. Wear your denture or partial as much as possible to reduce swelling from the surgical site. If you do not have a denture or partial, begin saltwater rinses 24 hours after surgery. After 24 hours, use heat on swollen areas as directed for the next 2 to 3 days. You have been given the following prescriptions. Pain medicine should be taken as needed. You may take ibuprofen, 400 to 600 milligrams every 6 hours, in addition to or instead of your prescription pain medication. While taking prescription pain medication, do not drive or operate heavy machinery. Be sure to eat something prior to taking pain medicine to reduce nausea. Antibiotics should be taken as directed until gone. Be aware that some antibiotics can reduce the contraceptive effect of birth control pills. Please contact your gynecologist or pharmacist if you have concerns. Nausea medicine should be taken as needed. Mouth rinse. Use as directed on the bottle. Avoid full-strength mouthwashes for 2 weeks. No prescriptions will be called in after hours.